Welcome. My name is Cindy Wright, and I'm a program manager at the Child Neurology Foundation. Today's talk is part of our series on going back to school during our new normal, with a focus on children and families with neurologic conditions. These sessions bring together caregivers and health professionals, as well as school personnel, to help have conversations and provide their expert advice to the child neurology community. Today, we're discussing considerations for medicine when sending your children back to school with Carrie Buck, Renee Schelhaas, and Angela McPhillips. Thank you for joining us. And with that, I will turn it off to you, Carrie, to introduce yourself.
Hey, thank you. My name is Carrie Buck. I am the mother of Cody, who's a 9-year-old with epilepsy and ADHD. And so I have worked with the school quite a bit on 504s and IEPs and just trying to coordinate, especially between multiple diagnoses, what he needs. And we work closely with the Epilepsy Foundation of Minnesota, wonderful organization that has really connected us to the local community and to a lot of resources that we need and connected me to Cindy here for today. So thank you to them too.
All right. Hi, everyone. I am Angela McPhillips. I am a nationally certified school nurse. I currently teach at the University of Illinois at Chicago as a clinical assistant professor in public health nursing courses, as well as school nurse certification courses. I do a lot of work with the National Association of School Nurses, as well as the Epilepsy Foundation, to advocate for children with epilepsy and also specific disabilities and children with special healthcare needs.
Great, hello. My name is Renee Schelhaas. I am a clinical professor of pediatrics in the Division of Pediatric Neurology at the University of Michigan. My clinical practice is focused on kids with difficult to control epilepsy. And although all of us have an epilepsy-related background here, we're not focused specifically only on kids with epilepsy in our discussion today. And I'm very grateful to be here. I'm really excited to learn from you, Carrie and Angela, about your perspectives and try to pitch in where I can.
Thank you. We are going to start with a few questions, and both of you feel free to answer whatever you feel is appropriate, or you can both answer to both of them. Obviously, the more information for parents, the better. So let's just start kind of with a general question, Angela. Are there specific types of medicines that school nurses are allowed to administer?
Sure. That's a great question. And generally speaking, school nurses are able to administer any medication as long as a valid current order is in place from a healthcare provider. So that order should include the name of the medication, the route, the dose, and the parameters for administering it. So is it a regular medication? Is it a rescue medication? So all of that needs to be specified in that order from the healthcare provider. Things can vary from state to state, so that is a general blanket statement. There might be other considerations in varying states when it comes to administering medications that are off-label, but typically all medications that are FDA approved can be administered by a school nurse. Something else to consider from that perspective when talking about medication administration in the school is if your child attends a school where a school nurse is not present during the day, the district and the school nurse who covers that district need to come up with a plan to decide on who a medication delegate can be and determine who the best person is to be trained to administer that medication in the absence of a school nurse.
So parents would want to start with a school nurse in the immediate building, if at all possible, to work out these plans. If a school building doesn't have a nurse, they would go to the district nurse.
Correct.
Correct. Okay. Renee, was there anything you'd like to add about getting the information to the school or the forms?
So I think many or most schools will ask what underlying conditions a child has. And for kids with neurologic disorders, typically that just having indicated that they have that diagnosis will flag that a nurse will reach out. So families don't need to feel like they need to figure out exactly who their district nurse is if they don't have a school nurse that they already know. typically the school's going to connect them because they want to make sure that the child is safe and that they're doing the right thing.
Okay. All right, kind of a follow-up question to that, Angela. Are there any treatments that a school should not administer specific to the climate that we're in right now?
So from my perspective, and I'm going to ask Renee to jump in on this one, I don't foresee any medications that are specifically, on a do not give list just because of COVID. And again, if a child needs a medication, they need the medication. And if that happens to be during the school day, then a plan needs to be in place to ensure that the child receives it. Specifically from the COVID perspective, in my area as a school nurse, I'm not aware of anything that particularly shouldn't be given. So I will pass this one on to Renee for her insight.
Sure. So the only things that I can think of that I would have a question about making sure that everybody was safe would be nebulized medicines or maneuvers that are designed to make a person cough. So if your child needs to take nebulized medicine inhaled and then say do a therapy vest, which is designed to make them cough and bring up mucus, that's going to be something you're going to want to talk pretty carefully with the school about how that can be done safely to keep everybody in that environment safe, or whether maybe this is a time when that isn't something that can happen at school and you'll have to work things out for an individual child. Aside from that, I think that all of our other regular scheduled medicines and our rescue medicines don't pose any specific additional risk to give to the child or to the people who are caring for a child. So I wouldn't say that there's a specific enhanced risk.
Okay, nothing really changing about medications themselves. So from personal experience, the schools do require documentation from the doctor as far as what the medication is that they're authorizing the school to administer it. Is there anything more right now that a family may want to add about either the treatment or the medication in those documents, maybe as far as like the administration of it or
So I think the thing that comes to mind from parents, teachers, nurses, doctors' perspectives are the rescue medicines. I think mostly where by definition you're going to have contact that's closer than 6 feet, right? And I think that first of all, rescue medicines are given in an emergency situation, and they can be given safely, and it is in the child's best interest to receive them as they are prescribed. So it's worth a very detailed conversation between the parents, the nurse, and the person who's going to be, closest to the child most often about what the plan ought to be for administering a specific rescue medicine, regardless of the condition.
Yeah, and I think, sorry. Just to piggyback on that, Renee mentioned a plan, right? And so when we're talking from the perspective specifically of seizures and epilepsy, the seizure action plan really is the foundation that provides very specific parameters for the school to follow in the event of a seizure emergency. So in that seizure action plan, that's the opportunity for the provider, the physician, the epileptologist, whoever's working with that child to provide the specialty care, to outline exactly what the student's seizure presentation is, what's normal, what's abnormal, what's their baseline, and when does a seizure become an emergency for that particular child. So that's really helpful for the school nurse and the school in general to formulate a response plan in the school building, whether a nurse is available or not. It outlines for people, if you see this, do this. And in the context of COVID, some of those recommendations might change depending on that particular child's needs. So that really is the foundation document to build on where these recommendations can be put in place by the physician and communicated effectively and in a meaningful way to the school.
Could you speak a little bit to maybe for parents who this is their first year dealing with rescue meds, just kind of walk us through that a little bit, like for example, where are they kept?
Yeah, sure. So again, this might vary from state to state, but generally speaking, Rescue medications are in a class of benzodiazepines, and Renee, please jump in if there's anything, different here. I'm speaking, incorrectly on anything. So with secure storage of those medications, typically they should be kept in a locked cabinet, yet a cabinet that is easily accessible in the event of an emergency. So there should never be a situation where the medication is locked up and nobody can get to it, because that defeats the entire purpose. So the medications should be kept secured and stored in a place that's easily accessible by the school nurse or whoever is delegated to be administering that rescue medication. There are different routes of administration. The standard go-to has been rectal diastat, so a rectal gel that's given for certain seizure emergencies. And there has been recent FDA approval for various forms of intranasal rescue medications as well. So again, the parameters are the same for storage and making sure that they're easily accessible.
Renee, do you have anything you'd like to add?
Yeah, the only other thing that I would add is I don't foresee that there's going to be a lot of going out on field trips in the near future, but should there be a time when a child's going to be leaving the school premises with a school personnel, that there's also a plan to make sure they have access to their rescue medicine wherever they should go. And that also is a pretty standard part of how a school is going to think about, how do I care for this child?
And as far as who administers them, is that vary by school? Is that fairly consistent?
From my school nurse perspective, it can vary from state to state. So again, that's dictated by the Nurse Practice Act within each state that guides the limits of nursing practice, or the scope of practice, I should say. And hand in hand with that, the school nurse is also working under the parameters of the district or the state board of education. Sometimes they speak the same language and sometimes they don't. So the school nurse is always going to adhere most closely to her Nurse Practice Act, because that's what governs the scope of her license, of her nursing license. That being said, again, a child who has an order for a rescue medication needs that medication in an emergency. So regardless of what the school nurse is able to do within that school or within that district, a plan needs to be in place to ensure that this child who needs this medication can receive it. Oftentimes that means that there will be extra education and training put into place for an unlicensed person, so somebody who's not a school nurse. That can be a teacher, that can be a classroom aide, it can be anybody who the school nurse at the district level or the higher level is working in conjunction with the school administrator to identify this person, ensure that this person is trained appropriately and meets the recommendations to safely administer this medication.
I think the other thing I would add is, sometimes a school is just going to be uncomfortable. And I think in the current situation, there is a lot of uncertainty and a lot of people are uncomfortable about all sorts of things. This is where reaching out, if it's a rescue medicine for epilepsy, reaching out to the Epilepsy Foundation in your state can be a great resource. And they have resources for training and teaching school professionals. And I would highly recommend, if you're having difficulty making a plan that seems to make sense for your child, that you reach out to the Epilepsy Foundation for additional assistance. And specifically the foundation that's the closest to your school, because they're going to have the most understanding and knowledge about the sort of individual local parameters.
Right. There's the National Epilepsy Foundation, but I don't know if most, but many states have individual chapters as well. So yeah, we found those helpful. So there's a rescue plan in place, or there's an approval plan in place from the doctor for meds, regardless of whether or not we're in COVID. Is there anything as far as administering a rescue med this year amid COVID that parents might be concerned about? We were talking a little bit, is it realistic to think the person who's administering it is going to put a mask on if they don't already have one? Thoughts on safety there, any changes in administration?
Do you want
Renee?
to talk about that, Angela, or do you want me to?
Sure. So I can start with my limited perspective, I think. And, as we said at the outset, a lot of this information is changing. So we're doing our best with the information that we have. I also think that, there is so much uncertainty that a lot of people might feel anxiety or uncomfortable in a lot of these situations. And, as parents, recognizing that level of anxiety and discomfort might exist within the school setting just as much as it exists for you as the parent, that might do well to kind of come up with an agreeable plan. There are some recommendations that are out there, and again, they might vary from state to state, but the National Association of School Nurses does have particular guidance for who within the school should be wearing what type of personal protective equipment. So it outlines different scenarios based on risk levels, so low risk, moderate risk, and high risk. And this is a great resource that you as a parent could potentially bring to your school and say, these are my concerns when it comes to school personnel having to be in close contact with my child to either assess them or provide a rescue medication. These are evidence-based recommendations. What can you as a district do to, put some of these things in place? That way you're coming to the district well-informed, better informed than you might have been otherwise without, this document or this resource. And it's just another level of support that you can bring to the district to try to come up with a good plan that ensures your child and the general population are safe.
Right. I think all of that being said, if a child needs a rescue medicine, they need a rescue medicine. And there shouldn't be anything that comes in the way of giving that child what they need to keep them safe, to stop the seizure or the allergic reaction or whatever it may be. So I think it's good to have a plan. It's good to understand what the practice is going to be for the adults who are in the classroom and around the child. Are they always going to have facial covering or not? Under what circumstances would they? But I think the bottom line of making sure that nobody's going to delay a child receiving a necessary emergency medicine should be the foundation of those discussions.
Yes. Yep, I agree with that. And especially when we're talking about the concept of rescue medications, the purpose of the medication is in the name, right? It's a rescue medication to rescue this child from a potentially life-threatening emergency. So when you look at it from that perspective in terms of risk versus benefit, face covering or not a face covering, like Renee said, that is an immediate acute need really to save this child's life or perhaps prevent a devastating injury or some bad outcome from happening. So if the child needs the rescue med, they need the rescue med, and it should be given.
Okay, thank you. I'm wondering now, kind of more just various neurological conditions in general. There might be children who have to take routine medications throughout the day and where they would normally be going to the nurse's office to do that. So can you tell us either considerations for that or things that the school should, are there guidelines about how they should put in place? Because you don't want children who potentially have COVID going to the same room of a child who just needs his prednisone for the day. So what are some considerations for that?
It's a great question. And I think all of us are trying to think about how do we keep ourselves as protected as we can and our families as protected as we can and avoid exposures to people who are sick, right? You see me sitting in my basement. There's a reason I'm working from home. That being said, all of our schools should have plans in place for how they're going to isolate children who should become ill while they're at school. And that plan should have a place that's separate from where anybody else is going to be walking through or coming in or out, because really the idea is to isolate that child until they can be taken to the appropriate home or back or to a hospital or a doctor's office. So I think it's going to help, I hope, settle nerves to talk to the school and find out what their plan is for isolating children who should become ill with COVID symptoms, because they should all have that plan in place.
Okay.
Mm-hmm. Yep, and I agree with that. And speaking from Illinois, which is where I'm located. The State Board of Education has released specific parameters for isolation rooms for schools that will be resuming in-person education. So it is out there. It's a known concept to separate children who could potentially have COVID from those who might not have COVID. So I think, again, it's a very valid concern as the parent to come to the school and say, what is your plan? And hopefully they should have an answer. And if they don't have an answer, then that can be a springboard for a discussion to hopefully put some things in place to keep everybody safe.
Okay. We talked a little bit, Angela, you talked a little bit about PPE. Do you have, either of you have recommendations or thoughts or how you're talking to your patients as far as wearing masks in school? And obviously we know that varies by state, and it's, we don't know what it's going to be like in the future, but any thoughts on that?
So I think the first thing is to know what the rules and expectations are in your area, and it can vary by county, by city, by school or school district, and by age of a child. The CDC has guidance as well. The bottom line is that for most of our children, they're going to have to learn how to wear a mask, over the next months and year. And I think for most of our children, they adapt to this a lot better than their adults do, right? They're finding their normal. And if you can find a mask that fits a child, that a lot of kids are doing a lot better than their parents are, frankly, with wearing their masks. And kids who we wouldn't necessarily, that we might have anticipated were going to have trouble, are actually doing quite well. So I think start with the baseline of, it's normal and everybody's going to do this, and it's about making sure that we're keeping safe and we're protecting the people that we're around, and it's showing respect to the other people that we're with to keep a mask on our face. So that's what we're going to do. What kind of mask would you like to wear? How can we make this cool and interesting and fun? So, I have one child who wanted astronaut masks. So we searched high and low and we found astronaut masks. I have another one who wanted flowers. So be it, right? If they're going to be happy wearing it, that's great. So I think that's the first thing, is baseline is for most kids, it should be fine to wear a mask. There are, of course, some children who are simply not going to be able to wear it. And then there's going to have to be a discussion with the school system about how do we do this? What are we going to do with children who either it's medically not safe, or who behaviorally they're just not able to keep something on their face? And how are we going to go about that? What are we going to do about other kids in their classroom? And those sorts of things are really important discussions to have. I think also knowing what the expectations are for the teachers and other staff in the school. Angela, what's your
honestly, I think you covered that very well, Renee. The points I was going to bring up, you did mention, when it comes to our little ones, making it fun is really what it's all about. And so if you can find a way for the kiddos who can tolerate a mask, where it is safe for them to tolerate a mask, medically okay, but they're still, hesitant or resistant, how can we as parents or healthcare professionals working with them, or the school working with these kids, how can we make it fun and really normalize it? Because, whether we like it or not, this is the new normal, and it just has to be. And so if everyone's kind of on that same page, instead of feeling defeated or, oh, he just, giving up, he or she won't wear the mask, what do we do? That's it. Kind of maintaining that positive attitude is as much as we can, and working together with families, with the school, with the healthcare providers to come up with a way to make sure that everyone is doing their part.
Sounds good, thank you. So as parents of children with neurological conditions, we have learned we have to educate the educators. Mm-hmm. When we bring our children to school, it's up to us to know what they need, how to interact between Renee and Angela, and doing it respectfully, but still being educated and the advocates that our children need. Are there any additional resources, any other things that parents might want to look into, or research in order to kind of bring a full picture of what they're going to need this year to keep their kids safe, to help the school understand what their children might need, given, you know, the special considerations of COVID.
So Carrie and Renee, you both mentioned the Epilepsy Foundation, and you know, over the last few years, I have done a lot of work with them, and I have found them to be an excellent resource at both the national and local level. So if you can find your local affiliate of the Epilepsy Foundation, that would be an excellent place to start. They have educators who can come in to the school to provide education to school nurses who might, you know, not be well informed on the care of epilepsy or, you know, other neurologic conditions. They can provide education for the school personnel, for administrators. So I think that's a great place to start. And then they also have advocacy, you know, support. So that's a great option too. I also think the PACER Center, PACER, is an excellent resource for children and families who have disabilities. Again, navigating some of those systems that might be challenging the special education process, ensuring that appropriate accommodations and modifications are in place to meet your child's needs when it comes to their neurologic condition. That's a really good one. And then lastly, I think we're going to see a lot more resources coming out, specifically the AAP, American Academy of Pediatrics, has a child and youth with epilepsy committee. I might be describing that wrong, but they have recently released some statements and resources for healthcare providers and schools. So we can also, you know, draw on those as support documents.
Yeah, I was going to echo, you know, our kids are kids first. And the American Academy of Pediatrics is there for all kids and has a lot of good resources, both for typical kids and for kids with special needs. So that's a good place to look, and they're pushing out policies as well. I guess the other thing I would say is if you're watching this, you found the Child Neurology Foundation. CNF has a ton of education materials, tools, resources, and ideas for how to help support families as they interact with the school system and the world around them right now.
Wonderful, thank you. And it's obviously a tricky discussion to have because none of us has ever been there before and we don't even know what it's going to look like. And I think we're all 4 in different states and it might look different for all 4 of us. So thank you for answering the questions to the best of your knowledge as of right now.
Right. I think that's a really important thing to underscore is that what is true today and what we understand about the virus today, as well as what's going on around us and what the policies need to be, may not be true tomorrow or next week. And so if you spoke with an administrator who said, you know, it has to be this way today, and then next week they come and they say it's different, you know, maybe that's actually a sign that they're trying to learn and understand and change with the times. And so it's important for all of us to realize that sometimes by the time we articulate a plan, it's already out of date and it needs to keep going. So the continued dialogue between families and their clinical teams and their school systems is going to have to be ongoing and dynamic throughout the school year.
Yes, I agree with that. The importance of communication can't be, you know, understated at this point because everything is so fluid, dynamic, ever-changing, and so the good communication is going to go a long way between the school nurse, between the healthcare provider, the administrators, in really making things transparent, right, and doing things as best as we can for today, right, based on the current recommendations.
Awesome. Thank you all for joining us today. I found this super informative. I know our community will also. And I want everyone to know who's watching this that while this was recorded today, we all acknowledge that things are changing. So on the page that you find this video, we are going to list answers to additional questions on this topic that have come up. We're going to provide links to some of the resources mentioned today. And you know, I think it's, because it is always changing, I think it's really important to be creative and be flexible and be patient. And And you know your child and you know your situation best. So it's always important to keep that in mind. And we also encourage you, we've mentioned the Epilepsy Foundation a lot. There's a lot of different neurologic conditions that have advocacy organizations that are working really hard to provide information specific to the condition your child may be having. But we also encourage you, keep up with what the CDC is saying. We'll try and keep it updated on our website. You're also gonna wanna check with your state Department of Education because they will have rules specific for your state. There'll be rules for your county. There might be rules for your city, for your school district, and for your school. So you're gonna need to make sure that you're doing your best to stay on top of all of that. And I know we have so much on our plate and we don't have a ton of time. So it's okay to ask for help from your neighbors, your friends, your family. And you know, we are all in this together. You're not alone. And on behalf of the Child Neurology Foundation, we want to thank you for joining us today. We encourage you to visit our website. We have a lot of resources for COVID-19 and what we're calling our new normal. So that's available on www.childneurologyfoundation.org/COVID-19. And just know that together we will get through this, and together we're all child neurology. Thank you.